There's been quite a lot of information around the development of the adolescent brain and what we know about the stage of adolescent development that has grown exponentially over the last decade. The reports that we put out recently, one that captures that science and our knowledge, and the other which applies it to our federal agency, the Office of Juvenile Justice and Delinquency Prevention, was an opportunity to think about what are the implications for the juvenile justice system from what we now know about adolescent brain development and adolescent development overall. The report that we're talking about today, which is the Reforming Juvenile Justice and a Developmental Approach as applied to the federal agency, was an opportunity to then take what we had learned in the first report and help the federal agency lead and facilitate change throughout the country by understanding the use of the science and how they, as the federal agency, can support the states, the jurisdictions, and the tribes to apply that knowledge to the work that they're doing with kids who are either entering the juvenile justice system or in the juvenile justice system. So what we have learned is that adolescents are very different from adults. And as a result, we need to address some of the things that we do in the juvenile justice system based on our understanding of where they are developmentally and where they are in terms of their brain development. The juvenile justice system has had a number of pendulum swings over the course of its history. Where we are now is understanding that the punitive approach that we have taken over the course of the last 30 years or so has probably resulted in outcomes that are counterproductive. What we now know is that in order to be able to look at juveniles and help them rehabilitate, help them learn and understand the consequences of their actions, and help them feel like the system that they are involved with is fair and just, we need to use the science around adolescent brain development appropriately so that they are being treated in a way that's going to help them grow into strong, healthy, productive adults. What we hope will happen as a result of these two reports, the first one that captures the science and the second one that applies that to our federal agency, will be that we'll have a system that will now begin to take into account what we know about adolescents and shift the way that we work with them so that we recognize the differences between adolescents and adults. We recognize that adolescents are at a stage where they're going to be taking greater risks and have less future orientation, that they are at a stage where fairness is fundamentally important to them, and that's both real fairness and perceived fairness, and that we need to take that into account as we're trying to look at kids and what we should be doing. And that the places where they are receiving services should be supportive of their healthy development, providing them opportunities for healthy risk-taking, opportunities for healthy development, and that all of the people in the systems, with the support of our federal agency and a greater understanding of the research, are using that knowledge and information to then allow them to work more effectively with kids so that they are recognizing that the development of their executive functioning skills are at different levels at different times with different kids, and until that frontal lobe is fully developed, we need to understand that they're going to be making decisions that may not appear logical to adults, but can be redirected if we recognize how to work with them. So the overall, what we hope the overall goal is for these two reports is that together they will allow the federal government and our state, local, and tribal governments to all be working together to bring to bear the knowledge that we have about kids and allow our system to then use that knowledge effectively.